Okay, hi everyone. My name is Aria, and welcome to the Intro to Sports Medicine workshop. So I think we'll just get started right now, isn't it? Okay, so for the agenda, the first thing we're going to be doing is like a little info session. So I'm just going to be giving you a little bit of background on the different careers that there are in sports medicine and like getting into some of the most popular ones. And then the second thing we're going to be doing is I have a special guest who's going to come and talk a little bit about medical school. Her name is Saloni Gupta, and she's here right now. And then the third thing we're going to be doing is a little activity to just loosen up your muscles and to see the different effects of some of the procedures that are done in the big like sports medicine career. And if you guys have any questions, you can just put it in the chat and I'll try to answer them in between, but if I don't get to them, then I'll just answer them at the end. Okay. So, oh my God. Oh my God. Why didn't it come back? Okay, one second. I think I'm having some technical difficulties. Okay. So now I'm just going to be introducing a couple of the different sports medicine careers there are and just going over the most popular ones. So first we have a nutritionist / dietitian, and then an exercise psychologist, athletic trainer, orthopedic nurse, a kinesiotherapist, physical therapist, sports psychologist, sports medicine nurse, psychiatrist, orthopedic surgeon, and chiropractor. There's actually many more sports medicine careers, but these are just some of the popular ones. And now I'm going to be going a little bit more in depth in some of these. Okay, so the first sports medicine career I have is called an athletic trainer. This is kind of a common one for athletes. They usually just focus on the performance of the athletes and they give them different safe and effective exercises to help with their sport. So for example, I play volleyball. So if I had an athletic trainer, they would be giving me different exercises. So for example, squats or lunges, just stuff to be helping with my legs because that's what we use in volleyball. And so they just do different exercises per your sport. They work at fitness centers, hospitals, universities, professional sports teams, and they can also help with nutrition program where they give a diet plan which you can follow to make you a healthy athlete. And to be a athletic trainer, you have to have a bachelor's degree in training and you must pass the BOC athletic training exam. Then we have a sports psychologist. This is not really it's really not a hands-on career. It's more of like a psychologist. And they usually just help connect the mind to the game, which will help with the athletic success. And usually what they do is if the athlete is having trouble with like competition amongst other players and just getting super stressed out with school and sports, then they usually help calm them down and they also give them different coping strategies to help. They also can help with coaches to make a happier environment because sometimes the coaches can get super agitated during games and practices if the player isn't doing something right, and then they can take out their anger on the players, which can cause tension, and the psychologists usually help with that. So to be a psychologist, sports psychologist, you have to have a bachelor's degree, a master's or doctoral degree, and it's recommended to minor or major in psychology. Okay, next is a orthopedic nurse. This is a nurse, but it's a little bit different. They just provide care to patients who have a bone or muscle disorder. They can also help with arthritis, broken or fractured bones, osteoporosis, and joint replacement. They can also help with casting, pain management, and musculoskeletal exams. These nurses work at hospitals, patient homes, doctors' offices, and they can also have their own private practices with the orthopedic doctor. And to be a nurse, you have to have done the National Council Licensure Examination registered nurse, and you have to have a bachelor's degree in nursing. Then we have a sports medicine nurse. The sports medicine nurses, they supervise the physicians treating the patients, and they're responsible for recording patients' medical histories, vitals, and other information needed for the doctor. So this type of nurse isn't really, it's a little bit different from the regular nurses, but they just specialize in sports medicine. And to be a sports medicine nurse, you have to have a bachelor's degree in nursing, orthopedic nursing, and these nurses are usually classified as nurse practitioners. Okay, so the next one is a physical therapist, and physical therapists are one of the more common sports medicine career paths because a lot of people end up seeing them. They help with post-injury treatment. So if you ever get injured, your doctor will usually send you to a physical therapist so that way they can make sure you have a safe recovery. They help with post-injury treatment, and they teach different techniques to help you recover from injuries. So for example, they can do like, I don't know, they can give you different ways of placing your body and making sure you're not putting pressure on the points which are hurting. And they can also help with severe pain in different areas of the body. Even if you don't have an injury and something is just aching in your body, you can go to them and they'll help you. They also do different procedures such as massaging and different techniques of icing and heating. Physical therapists work in rehabilitation centers, hospitals, schools, and usually have their own clinics. And to be a physical therapist, you have to have a bachelor's degree, a doctor of physical therapy, and you have to have passed the national licensure exam. Okay, so the next, wait one second, let me just check. Okay, so to be an orthopedic surgeon, an orthopedic surgeon is actually one of the highest paying surgeons that there are. So it takes a lot of work to be one of these, but it's a really fun career. So orthopedic surgeons do surgical treatment on bones, joints, tendons, and muscle disorder. They can also do different specialties, like they can have like different specialties that they work on. So there's different kinds of orthopedic surgeons. So they can like do like waist or shoulder or hip. And yeah, like I said, it's a very high paying surgery practice. However, you have to be super hardworking in order to be one. And they work in hospitals or private practices. And to be an orthopedic surgeon, you have to have a bachelor's degree, a doctor of medicine degree, which is med school, and you have to have done 4 to 5 years of residency. And if you don't know what residency is, it's basically where you're in the hospital as a student and you're just working with the other doctors and shadowing them and just seeing how it's like and learning more about working in the hospital and the environment, and actually like more hands-on. Okay. Then a chiropractor. A chiropractor is another one of the super common careers that in sports medicine, and they can actually also help people who aren't into sports. Like if you feel like your bones are kind of out of place, then they can just put them back into place. They usually adjust the spine and different joints in the body, and their main goal is to correct the alignment of the bones, ease pain, and help the body function easier. And this can also help with blood flow, because if your bones are in the right place, then you can move properly without pain, which will help the blood flow easily. And they work at hospitals or with sports teams, and most of the times they have their own practices. And to be a chiropractor, you have to have a chiropractic degree and a state license, since it's a pretty intense job. Okay. So then the last but not least is a nutritionist. They usually guide you on how to live a healthy life, and they can give you a diet plan with foods that you really enjoy. So that way it's not just boring and they give you an unrealistic plan which you won't follow. And most of the times they help with the weight loss. So if someone really needs to lose weight, they would go to a nutritionist to change their diet in order to become more fit. And they can also help with certain illnesses. And in addition to all this, they can also help patients with providing them with enjoyable recipes. So like a healthier version of something that they like. And nutritionists work in hospitals, nursing homes, clinics, and cafeterias. And to be a nutritionist, you have to have a bachelor's of science degree in nutrition. And if you want to know more about this, about nutritionists, then there's actually another workshop that goes more in depth into nutritionists, and that can be found on the Gstem Instagram page, or I will provide the link in the chat. So yeah, these are all the sports medicine careers. Let me just check the chat really quick. Okay, yeah. So Saloni is going to be answering your questions. Okay, so now I'm going to pass it on to Saloni, and she's a medical student at UCLA, and I'm pretty sure, in her second year of medical school. So yeah.
Thanks, Aria, and thanks for inviting me to be a part of your workshop. Let me share my screen. Actually, I think you have to make me a co-host.
Oh, I think Alicia can do
that. Okay. All right, so I'm going to be talking a little bit about myself, med school, and then I have a practice case that we're going to do together, just so you guys can kind of get your feet wet and see what it's like to be in orthopedics or sports medicine or just medicine in general. So I really recommend that you unmute yourself and participate, because it's going to be a lot of fun. So about me, so I grew up in the San Francisco Bay Area, just like you guys. I went to Hillsdale High School, which is in San Mateo, and I had a lot of fun. I did a bunch of stuff like mock trial, and like I was on the newspaper team and stuff like that. Then for college, I actually went to community college and transferred. So if you have any questions about that, you can definitely ask me. And I transferred to UC Santa Cruz. Go Banana Slugs. And then I'm currently a medical student in my second year, like Aria said, at UCLA. And in the future, I'm really interested in global health. So working with underserved countries and doing like public health and education and things like that. So Aria talked about orthopedic surgery already, but just as kind of like a breakdown. So you start with your high school diploma, which is 4 years, and then you get your bachelor's degree, which is also typically 4 years, can take shorter or longer depending on what you do. Then you can take gap years, which is really common. Most people take 1 or 2 gap years before going to medical school, which is 4 years. And then if you're interested in orthopedic surgery or orthopedics, that's 5 years of residency in which you are already a doctor at that point. So you're seeing patients, but you're learning how to do surgery and you're learning like specifics of the profession. And then if you're interested in sports medicine after that, it's a 1-year fellowship. So what is med school like? This is just kind of an overview. So we have lectures just like you guys. We have a bunch of labs. So we have cadaver labs, which I'm sure you guys have heard about. So that's when we have donor bodies of people who have passed away and we learn anatomy and we do procedures on them. We have histology, which is looking at specimens under microscopes. We learn interview skills, like how to talk to patients. Physical exam, like how to do the different maneuvers when you see a patient, and ethics. We do a bunch of clinical case studies, which I wrote one for you guys today, so we're going to go through that. Then we see patients in different specialties, and then ultimately you choose what you want to go into. So here's our clinical case study. Again, there's like no wrong answers here, so I really recommend just try it out. Because you're not expected to know anything, so you might as well try, right? So we are all a pediatrics team at San Ramon Regional Medical Center. So we're gonna be working together to diagnose our patient today, who is 7-year-old Dakota. So today, Dakota was at the skate park with his friends. He tells us that just as he was about to skate down a hill, he felt a dull pain in his left leg. He had felt it this morning too, but he ignored it. And as he reaches the bottom of the hill, a sharp pain shoots through his left hip. So his parents brought him into the pediatrician's office, and now we're going to see him as our patient. So what are some of the questions that we want to ask Dakota? Just throw some out. And feel free to unmute yourself. And you can also chat it in. And Aria, if you don't mind just reading those, if they come in the chat. You can try to think about when you've gone to your pediatrician's office, some questions that they've asked you. Other things you want to know about our patient's leg.
Okay, so a couple of questions are, how much pain is he having?
Mm-hmm.
And has he ever felt this specific pain before? When do you feel this pain? And if his leg hurts or his hip hurts more?
Yes, those are fantastic questions. Great job, you guys. So that's exactly right. We want to know more about the pain, if he's had it before, kind of more characteristics of the pain. So let's go to the next slide. Okay, so we asked Dakota, do you have any pain now? And he says, it felt sore in my groin area at the skate park. My pain is mostly gone now, but I'm walking with a limp. Then we ask, how bad does it hurt? Which someone mentioned in the chat. So he says 2 out of 10. So 1 is like barely any pain, 10 is like worst pain of your life. So he has a 2 out of 10 right now. Have you had anything like this before? Which someone mentioned also. He says no. And then, have you been sick lately is also important because sometimes like after you get a cold, you can get joint pains and things like that. So he says no, I've been healthy. All right, so next we're gonna do the physical exam. So what are some of the things we wanna look at on the exam?
Okay, someone said if there's any swelling or bruising.
Yes. What about some things that you do every time you go into a doctor's office, no matter why you're there?
Vitals?
Vitals. Yes. Temperature. Yes. Reflexes. Fantastic. You guys really know your stuff. Okay, so let's go into the exam. So we're going to start with vitals, which we always do. So we have temperature is 98.9, pulse is 88, respiratory rate is 16 breaths per minute, and blood pressure is 110 out of 70. Does anyone know if these are normal or if there's anything abnormal here? And feel free to guess. All right, so I'm gonna tell you guys, these are all normal. So everything looks good in terms of vitals. Now we're gonna go through the exam. Usually we go head to toe. So general is like you're just looking at the patient. How do they look? So our patient, Dakota, looks well-developed, well-nourished. He's a white male. When we listen to the heart, normal heart sounds like the lub-dub that you'll hear when you listen to the heart. The abdomen is soft and non-tender, which is normal. Non-tender means that they don't feel any like pain or anything when you push into it. And then we're looking at the extremities, which means your arms and your legs. So there's full range of motion in all of the joints, which means that they can move like normally, like they normally would, except for the left hip where the movement is decreased and with pain. Someone mentioned swelling, so we don't see any swelling, and someone mentioned reflexes, which are all normal, and the spine is also normal. All right, so the main thing that's standing out here is really just the left hip. So what do we want to do next? So we've done our history, which means we talked to the patient. We've done our physical. What's next?
Someone said get an X-ray.
Yes, exactly. Great job, you guys. So we're gonna do an X-ray. Here's our X-ray. So you can see the left hip is marked with this L here. Does anything look abnormal to you guys? And it can be kind of hard to see. Just shout it out if there's anything you see.
The right hip is lower than the left.
Yeah, that's true. I think it's just the angle of how this photo was taken, but that's a really good observation.
It seems like right under there's like, it looks kind of different. Like the left side, that, but yeah, like if you go down more. Yeah,
Here?
right there. Yeah.
Yes, exactly. So that's the area we're looking at. So this is our hip joint right here. And this is where our femur or leg thigh bone basically fits into our hip. And you can see, yeah, it's a little bit different here. So is there anything we can do next to get a better view of this? So we did an X-ray. What's another thing we can do to see better?
Another X-ray, like from the back.
That's a really good point. So for X-rays, you're right. You always want to do multiple views because one view, they always say one view is no view, which basically means like you can't really tell just by looking in one direction. So that's a really good point. I was thinking more of a different type of imaging that we would do.
MRI.
MRI,
CT scan.
exactly. CT, yeah. So in this case, we would do an MRI. So let's go into that. Okay. So here's the MRI. What are we seeing now? Just any observations that you see.
The right side is different.
Yes, the right side is different. Exactly. So here's our left side again, and here's our right side. So the right side here looks pretty normal. This is what we would call normal. And then like Aria said on the X-ray, something looks different here. You can see that this line is pretty smooth over here, and over here it's kind of jagged. And over here it's not as round as it is on the right side. So you can see that the bone is kind of starting to get damaged a bit and kind of degenerating. Degenerating just means it's kind of like breaking down, not doing so well, it's losing its shape. So after this, we can make a diagnosis. Does anyone have any thoughts about that? And totally fine if you don't know, because I didn't know what this was until med school. But any kind of guesses on what might be going on?
A broken hip.
A broken hip. Okay, that's a good guess. Yeah. In that case, you would see more of like a line going through the bone. In this case, this line here is normal though. It's just a little bit jagged and the bone is kind of disintegrating a little bit.
And then someone said fractured femur or a bruised hip.
Yeah, those are good points too. So fractured femur, you would see a break. So you would see more of a line in an area that you wouldn't expect it. So that's not what we're seeing here. And then in terms of the bruising, you would see that on the outside, right? Like on the skin, versus this is something we're seeing on the inside, like in the bone. You're seeing this bone damage. So I'll just go ahead and tell you guys what it is. And thank you for guessing. This is really hard. So this is called avascular necrosis of the femoral head. And I'm going to break that down because it's really long. What that means is the femur is your bone in your thigh, right? And so femoral just means femur. And then head is the round part that fits into your hip. And what's happening here is you have these blood vessels that are actually being cut off. So your bone isn't getting the blood that it needs and the nutrients that it needs, and now it's disintegrating. So that's why on the X-ray, you could see that the bone was kind of breaking down and losing its shape. So this is what we would call avascular necrosis, which means basically death. Avascular is like lack of blood flow to the femoral head. And so how would we treat this? So we are a pediatrician's office, so we want to send Dakota to an orthopedic surgeon that specializes in bone and muscle. And then the orthopedic surgeon ends up recommending bed rest for 6 weeks so that Dakota can recover. Luckily, the X-ray wasn't that bad. And so Dakota recovers, and then an MRI 6 weeks later shows Dakota is recovering. And then Dakota is able to start bearing weight in 3 months. And in 7 months, he's able to go back to the skate park. So this is a really good case to kind of go through like your thought process that you would have in the clinic, and then see like when you need to refer someone over to orthopedist. And that's it for the case. So you guys can totally email me if you have any questions about the case or any of these other things, and I'm happy to help. Back to you, Aria.
Okay, thank you so much, Saloni, for that. I think it was really entertaining and really interesting. So now we're going to be doing a little activity just to, it's more about kind of the physical therapist side of this stuff. So what we're going to be doing is like, I guess you could call it like a little yoga session, quote unquote yoga session, but we're just going to be stretching a couple parts of our bodies. And then hopefully after that, you'll see the effect of the stretching, and hopefully your body will be feeling a little bit more loosened up. So if everyone, I know your guys' camera's off, but if everyone can like do it with me, it would be really beneficial, so that way you can see the effects of it. So the first thing that we're going to be doing is just like neck rotations. So you can just take your neck and like roll it onto one side, and then like on the other. And just hopefully you're feeling the stretch in your neck. And then you can take your wrist and go like that. So it's like stretching this part, your forearm. And do that for like 5 seconds. And then switch to the next arm. And then do like arm rotations too. And then since we're sitting, this could be a little bit hard, but if you just take your arms and like interlock them in the back and then kind of just like stretch it out like that, and like pull your like chest forward, and you can like feel it like all in your arms. It's a pretty good stretch. Okay, and then another one we can do is like, I don't know what they're called, but you can go like this, so that way you're stretching this part of your arm. And switch. Okay, and then we can do a little bit for our legs. So if you just take your foot and then if you just plant it against like some kind of like a platform, like your bed or something. So if like this is your bed and then your foot can go like that. So it's like stretching your entire calf. You can try to do that. And that just, you can like feel it in your calf and just, oh, this is also good if you go running, if you like to run a lot. I think this is a good stretch for your back. And then your other leg. Okay, so those are a couple stretches, and I hope that whoever did it, you guys are feeling a little bit like more loose in your body. And I know it wasn't a lot, but usually if you do like an entire yoga video, then you'll be able to feel the different effects of that. And that also comes with sports medicine, because sports, like if you have to stretch in sports, obviously, so otherwise you can pull other muscles in your body. So yeah, I hope that helped. And now we're just going to be doing a little, if you guys have any questions for me or Saloni, then you guys can just ask us. We can do like a little Q&A session, anything about her or anything about any of this. If you guys have any questions, then you can just speak up or put it in the chat.
So what does like a daily routine for you look like? Because you're in med school and like with quarantine and everything, how is it going?
Yeah, that's a good question. So this semester was actually optional for us to go in person. So I opted out of that. And so I'm just at home. But we still have lectures in the morning, just on Zoom, like you guys. We have labs. Typically, the majority of the labs are done in first year. So like cadaver lab with anatomy and microscopy and things like that are all done in first year. So luckily, I don't have to go in person for that, but we have like online labs where we'll interview patients, or like talk through a physical exam instead of like actually doing it. And next semester I have to go back in person, because we'll be seeing patients, obviously wearing all the PPE and everything. Yeah, so it's not that different, I would say.
Do you feel like your high school and like where you went for undergrad really affects your medical school experience or acceptance?
Yeah, that's such a good question, and I'm so glad you asked. So, no, it does not matter where you go for college. I tell everyone this. Everyone tries to like get into the best college you can, and that's like fine, that's great. But there's a lot of colleges that are not necessarily good for pre-med. For example, UC Berkeley and UCLA have like so many pre-meds and are like so competitive, right? That when you go there, it's really hard to do well because it's so competitive. And a lot of people that go there end up dropping pre-med just because it's so competitive. Versus if you go to another school that has less pre-meds, is maybe like a little bit smaller, I would recommend that because it's easier to stand out that way. Med school admissions committees look much less at where you went to college and much more at what your GPA is and what you did. Oh, why did you choose your current med school and why do you like it? So I really want to stay in California, so that was really important to me. And I chose the current school because it's a really good research university. So there's a lot of opportunities in research no matter what you're interested in. So I'm really interested in like mind-body research, meditation, and things like that. So I found a lot of opportunities there for that. And I just really like the vibe. So for med school, you have to interview wherever you go. And everyone there was just so nice, so warm. Like a lot of places I interviewed, they were kind of like really harsh and scary, honestly. And I didn't get that vibe at all. So that's why I really like it. And I like it now just because there's so many opportunities. Like we have hands-on, not during COVID, but otherwise we have hands-on workshops. Like we had this abortion workshop on papayas, because papayas like resemble uteruses, and we learned how to do like abortions on papayas and things like that. Like there's a lot of cool hands-on things that I don't know that other schools would offer as much of, just because it's such a big research university and a large health system.
Sorry, I have another question. I have a lot of questions.
Yeah.
So would you recommend doing like a BSMD program? What do you think?
I think that's a really good idea if you know right now that you absolutely want to do medicine. It's kind of hard to know though, I think, coming out of high school. But if you're absolutely sure, like I think I was absolutely sure, honestly, then I would recommend it, because you save a year in some programs. You don't have to take the MCAT, which is huge, because MCAT studying is like such a pain and like honestly really stressful. And you have a guaranteed med school spot. And then if you're in one of those programs and you decide that you want to go to another med school, you still have the option of taking the MCAT and switching. So I think it's a good idea if you know what you want to.
Oh wait, sorry.
What surprised you most about your medical school studies? That's a really good question. I think it's just the volume of information. So they compare it to drinking out of a fire hose. So it's like this fire hose, like of water coming at you, and you're just trying to like drink out of it and get like what little you can. So I think it's just the volume of information, like just never ends. And just being able to know when to stop, because obviously like you can keep studying forever into the night, but like that's not necessarily good for you. So I think just knowing like your limits and being okay with stopping.
Do you feel like you have like school work-life balance? Like do you feel like you have like a few hours every week or day, like your free time? What's that like?
Yeah, good question. So I think my school is really unique in that we get a lot more free time, I think, than other med students in other schools. They try to make it like very stress-free, I think. One thing that contributes to that is pass-fail. So I highly recommend going to a med school that has the first 2 years as pass-fail, because that way you don't have to learn every tiny detail. Like you can focus on doing other things, like going to the workshops I was talking about and learning like other skills. So I highly recommend pass-fail. But yeah, I would say I have a really good work-life balance. Again, it's just like knowing where to draw the line, right? Like orthopedic surgery is really, really competitive. And so if I knew I wanted to go into that, I probably wouldn't have a work-life balance, but I know I don't want to do that. So I can take like a few hours every day to like do my hobbies and things. Yeah. What information and advice do you wish you had known when you were beginning your medical studies? That's a good question. So do you mean like beginning undergrad or beginning med school? Both, okay. So for undergrad, I think do what, and everyone says like, do what you're passionate about, and it's such a cliche, but it's true, because your passion is going to show in your interviews and in your essays. So like a lot of people are like, okay, I have to like check off this list of things. Like I need volunteer hours, I need research, I need clinical stuff. And that's like the list. And it's true, you do need a little bit of each of those things, but you don't have to do the traditional things for each category. So like a lot of people say volunteering in a hospital is like the thing to do for clinical hours, but you don't necessarily have to do that, right? Like if you want to volunteer, I volunteered with the Santa Cruz AIDS Project when I was in Santa Cruz. So we had, we worked with people who had HIV out in the community. We did a lot of like outreach and education and stuff like that, which I'm really interested in. So my passion, I think, showed through in my interviews, even though that was like the non-traditional thing to do. Same with majors, like you don't have to major in bio, you can major in whatever you like feminist studies, art, math, like whatever you like. And that passion is going to come through in your interview. So don't do anything because you have to do it, because they're going to be able to tell that you just did it because like that you had to. And then when I started medical school, what advice? I think just really enjoy first year, because first year is very chill compared to second and third and fourth. So everyone's like, you know, take first year to make new friends and do fun things and like enjoy where you've moved to. So I think, yeah, taking first year to just enjoy and like create a community for yourself is really important. And then that's going to come in handy moving forward.
Do you think it's important to major in something that's like objectively harder? Like, I know you were talking about how you don't have to major in bio, but is it better to major in something like objectively easier, like public health, because you have a better GPA for med school?
Yeah. So I think don't go off of it just based on what's easier, but what you're going to like the best, because then you'll tend to just try harder in those classes. Like, I know there's no way I could major in philosophy because it's like so hard and I'm not interested in it. And so that would just show in my grades. So choose like what you're really interested in. And I think that will show in your GPA. Yeah. But definitely don't just choose bio because everyone does. In fact, I think choosing something else will help you stand out.
Do you think it's important to have like backups just in case like you don't get into med school?
I think as you go along, like you'll see. So of course, if you're in a BSMD program, you don't need backups, right? Because you'll like probably get into the MD. If your GPA is like a 3.5 or whatever. I think as you go along, you'll see though, because I know a lot of people started freshman year of college as pre-med and then ended up like changing their minds halfway, like second year or third year, just because their GPA wasn't good enough, I guess, to apply to med school. So you'll see as you go. I think like when you start, you don't need a backup. You can just go full force. Like, I want to go to med school. But then as you go along, if you see that like, oh, maybe that's not feasible, then you can start thinking about other things. And there's so many options. Like DO schools are like amazing too. And like physician's assistant. And then all the things Aria mentioned, honestly, are amazing. So yeah, you'll come up with your backup plan if you need to as you go. What is something you would recommend for high school students who are interested in medical so they are successful in college and med school? Yeah, a good question. So I would say there's no like specific, let's see. Okay, so I think the most important thing would be developing good study habits no matter what you're studying. Because even if you know you're really interested in med school now, like even when you get to med school, there's going to be subjects you don't like. Like we still have a lot of like chemistry and physics, which like most med students don't like. So just developing good study habits to be able to like do well in any subject, I think is really important. And also figuring out your study style. Like I'm a very visual learner. So when I see things on paper, like it goes into my brain versus if I'm listening to a lecture, like it doesn't. So figuring out your study style too. And just building like stamina, I would say, like for studying.
Is there anything specific that you do that helps you study or like retain information?
Yeah. So I recommend this to a lot of people. So it's called active recall. I think that's what it's called. Yeah. And I do that a lot. So I'll like read, so I really like to see things. So I like reading textbooks. So I'll like read a page on a textbook and then I'll close it and I'll like say everything I can remember out loud, like just to myself. Or I'll like go for a walk and I'll like say, I mean, I look like a crazy person, but I'll like say out loud everything that I remember reading. And then that way you're like actively trying to recall instead of just being like, yeah, I know that. And then you actually don't remember it. And then I'll like go back and look and see how much of it I could remember. So yeah, actively recalling. I think that's also really time efficient too, because like I'm not a huge flashcard person or like taking notes person, because that takes a lot of time. But if you're just like talking it out, you can go much faster.
So do you have like blocks where you learn about specific subjects and then at the end you have finals?
Yeah, exactly. So we have, in the first 2 years of med school, it's preclinical curriculum. So we have 9 blocks, and each block is focused like on a body system. So right now we're doing, for example, reproductive medicine. And then at the end of each block, it's a final, exactly. And that's the only thing that counts. Like we have quizzes every week too, but they don't actually count. And then we have a pass-fail final at the end of the block. And then the 3rd and 4th year of med school are all clinical, in which you also have blocks called rotations, and you're going through the different specialties. So you do like 6 weeks of pediatrics, 6 weeks of family medicine, 12 weeks of surgery, and then at the end you have an exam.